Yeah, so first of all, I think we still have to keep working hard on resolving supply bottlenecks. It's not that we have enough supply to go around in the UK, in Europe, in North America, or in other parts of the world. So we've got to keep the focus on enhancing supply, whatever means are needed for that. But as you pointed out, currently what we're seeing is a mismatch between demand and supply. And I think what we've highlighted in the past is hard infrastructure constraints, such as having more trucks or having ultra cold chain freezers, are the problem, which is more on the supply side alone. But what we've got to ensure is that the soft infrastructure, and soft infrastructure implies the people who vaccinate, the ones who've got to follow standard operating procedures, the vaccinators, the operational logistics, those and the information systems, that's more of the soft infrastructure. And I think matching demand and supply requires a lot more investment in soft infrastructure, better planning. And that's what we're seeing in the US, in many other parts of the world, where we're seeing there is sufficient supply, but the uptake hasn't been as high. But again, I think we've got to keep in mind that this is like the soft launch of any given product. It's not a hard launch. A hard launch will be when we get to phase 2, when we would have large numbers of retail pharmacies, mass vaccination clinics. So we should not extrapolate too quickly from what we're seeing in the first 4 or 5 weeks. There is more to be done. There is also the issue of diffuse accountability, because there are multiple levels of government agencies involved. And we see comparisons being drawn out between health systems which are intrinsically very different, such as Israel versus the United States versus UK versus France. And those intrinsic differences in the health systems will now show up as differences in the rates of demand side and uptake. And we can't resolve them overnight. So these will be things that will take time.